I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. Why did it take public health officials so long to realize that COVID could be transmitted by talking or even just breathing? This is the People's Pharmacy with Terry and Joe Graydon.
Dr. Lindsay Marr is one of the world's leading authorities on the airborne transmission of viruses, bacteria, and other pathogens. She'll describe why we should all be paying more attention to ventilation at home, at work, and even when we're out and about.
Dr. David Peden will join us. He's an expert in environmental medicine, asthma, and lung biology.
We'll get practical tips on improving and monitoring ventilation and air quality.
Coming up on the People's Pharmacy, how to avoid airborne viral transmission.
In the People's Pharmacy Health Headlines, there are 3 worrisome variants of SARS-CoV-2 circulating in the U.S. Most prominent is B117, originally identified in the UK. It's been found in all 50 states and has infected at least 15,000 citizens. This version of the virus is more contagious and more lethal than the original. The P1 Brazilian variant is widespread in Massachusetts, especially on Cape Cod. Like B117, it's also more easily transmitted. Then there's a double mutant variant. It's driving a devastating surge in India and has also been seen in California. 2 mutations enable the virus to attach to cells more readily. Experts hope that the vaccines currently in use will continue to work against all 3 variants.
India now has the unenviable distinction of leading the world in new COVID cases. More than 100,000 people a day are being identified. The virus is spreading to all age groups at an alarming rate. As in many parts of the U.S., people in India have grown weary of restrictions and are starting to circulate more freely. Weddings that were postponed are now going forward. Festivals, cricket matches, and election rallies are turning into super spreader events. Vaccines are being administered, but not rapidly enough to protect a sizable proportion of the population at this time.
Some researchers are warning that we may have to deal with serious consequences of COVID-19 for years. A study published in Lancet Psychiatry found that a third of patients who had recovered from the coronavirus infection were diagnosed with a new neurological or psychiatric problem within 6 months. The investigators reached this conclusion by analyzing health records of more than 230,000 individuals. Depression and anxiety stood out among the most common diagnoses. One of the researchers remarked, "Our results indicate that brain diseases and psychiatric disorders are more common after COVID-19 than after flu or other respiratory infections." Less common, but more serious, were strokes and dementia that occurred within 6 months of recovery.
How good are physicians, nurse practitioners, and physician assistants when it comes to diagnosis? A study in JAMA Internal Medicine suggests that many healthcare providers drastically overestimate the likelihood of a specific disease condition. The investigators surveyed 553 health professionals. They tested them on 4 different hypothetical scenarios. Patients presenting with possible symptoms of heart disease, breast cancer, pneumonia, and urinary tract infections. For each scenario, the researchers had calculated probabilities based on the scientific literature. The subjects were asked about the likelihood of these conditions before seeing test results and again after they were provided. The authors conclude widespread overestimates of the probability of disease likely contribute to overdiagnosis and overuse.
Scientists have finally accepted that SARS-CoV-2 often spreads through aerosolized particles that can travel long distances through the air. Now the question is how to prevent its spread indoors when people are not coughing or sneezing, but just breathing and talking. Researchers in India have looked at leakage from masks and found that it could lead to viral transmission. They used a mannequin with a mechanical breathing simulator and a fog generator that produced particles from 1 to 10 micrometers in diameter. When the mannequin had no face covering, droplets from simulated breath zoomed up to 4 feet in just 5 seconds. A surgical mask allowed significant leakage. However, a commercial 5-layer mask provided good protection. The commercial N95 mask was not quite as good, as there were leaks at the top of the mask where it didn't conform closely to the bridge of the nose. The bottom line is that indoor spaces need excellent, fresh air ventilation to maintain good air quality, even if people are masked. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon.
A lot of people would like to put all thoughts of COVID-19 behind them. Even though more than 60 million Americans have been vaccinated, there are still far too many places where the coronavirus is spreading rapidly. On any given day, over 60,000 people test positive for SARS-CoV-2, and hundreds die.
That's why it's so important to understand how the virus spreads and how best to avoid catching it. Even after vaccination, some people will contract COVID-19. As good as the vaccines are, they aren't perfect, so it makes sense to protect yourself and your loved ones. Today we're talking about aerosols and how ventilation can help reduce the chance of viral transmission. How can you tell if a space is adequately ventilated?
Dr. Lindsay Marr is a professor of civil and environmental engineering at Virginia Tech, where she leads the Applied Interdisciplinary Research in Air laboratory. Her research group focuses on 3 main areas: how air inside buildings and outside in the natural environment affects, transports, and interacts with pollution; the dynamics of biological aerosols like viruses, bacteria, and fungi; and the characteristics of the tiniest of natural and man-made particles called nanomaterials. Dr. Marr teaches courses in environmental engineering and air quality, including topics in the context of global climate change, as well as health and ecosystem effects.
Welcome back to the People's Pharmacy, Dr. Lindsay Marr.
Hi, it's a pleasure to be here.
Dr. Marr, you recently testified before the House Committee on Education and Labor. Your talk was titled Protection Against Transmission of COVID-19. Dr. Marr, what have we learned over the course of the last year about the transmission of this virus, please?
When the pandemic first started, we were told to make sure we washed our hands well, watch out for contaminated surfaces. There was talk about wiping down groceries, and also about staying far enough away from other people. And that was because people thought that the virus was transmitted mainly in these large droplets that come out when you cough, and they're big. They could land in your eyes, your nose, or your mouth. They could land on surfaces and contaminate those surfaces. You could touch that contaminated surface and then transfer the virus into your body. But since then, we've learned that probably the main route of transmission is by breathing in the virus from the air. It's in droplets, but these droplets are so small that we can't see them, and we call them aerosols. And so that's due to a number of different lines of evidence. There's super spreading events where over 80% of people become infected when they're in the same room together. There's scientific evidence of lab studies, measurements in hospitals, and also an important key is the fact that the virus is transmitted asymptomatically. So people who are infected, but they don't know it because they don't have any symptoms, they can still spread the virus. So they're not coughing. It's just through their regular breathing and talking that they're transmitting.
Dr. Marr, there's been a lot of resistance to what you're talking about. I mean, even the CDC to this day hasn't completely embraced the aerosol issues, the airborne issues with their guidance. Why do you think we've been so slow to recognize that aerosol transmission is the biggest problem?
I think there's a few reasons why we've been slow to recognize aerosols. The first is that there's a very limited understanding of aerosols in the medical community. And when different transmission routes were first identified 100 years ago, there was no way to detect the aerosols because they were invisible. And researchers focused their efforts on large droplets that come out when you cough, or sometimes when you talk too. And so there's this long-standing bias against transmission of viruses through the air this way. And there's kind of a higher burden of proof to show that this transmission route is important. And the second reason is that there's reluctance to describe the virus as being transmitted through the air because the word airborne has a very special meaning in hospitals. If they were to call a disease airborne or a virus airborne, it means that they would have to provide all the healthcare workers with N95s and use negative pressure rooms for patients. This is pretty resource intensive, so they really only want to do that when they're sure that a virus is being transmitted this way. But, I would say that to speak to the public, really the clearest way to convey how the virus is transmitted is by calling it airborne, because it's not waterborne, it's not foodborne, it's not vector-borne. That's things like that are carried by mosquitoes. And then third, I think a lot of the messaging from the public health agencies has been driven by the reality of supplies. And early on in the pandemic, there was a shortage of critical supplies like N95s. And so, the CDC couldn't say, oh, it's airborne, everybody needs N95s, but there's no N95s. So those are, I think, the three main reasons why there's been this reluctance.
What are the implications for how we can protect ourselves and really everybody against infection with COVID-19? Because although we have made a good start on vaccination, definitely not everyone is vaccinated yet. There's still COVID-19 virus out there.
Probably the easiest way to think about how to protect yourself is to think about how you would reduce your exposure to cigarette smoke if someone were smoking a cigarette in the same room as you. The first thing you'd want to do is to have the person stop smoking. And this, I'm following the hierarchy of controls, which is kind of the strategy that we use to reduce a hazard. And so this first thing you want to do is reduce the source. And so, okay, you could remove that person. One thing we do is masks. So masks are used for two reasons. One is to protect others. So if someone happens to be infected and they don't have symptoms, putting a mask on them greatly reduces the amount of virus that they're going to spread into the air. The second thing you can do is to move outside. If you're near a smoker outdoors, you'll end up breathing in a lot less smoke because there's so much more dilution in outdoor air. If you do have to be indoors, then engineering controls like improving ventilation, and this can be as simple as opening doors and windows, will help bring down the levels of virus in the air. If you have an HVAC system, a mechanical system, you'd want to bring in more outdoor air and use less recirculated air. Sometimes with air conditioning on or heat running in certain buildings, it's really just recirculating that same air over and over again. Those systems do have filters in them, and you can upgrade those filters to remove some of the virus particles or cigarette smoke particles from the air so you're not breathing as much. And then the final kind of layer of defense is what we call personal protective equipment, and that is the mask again, and it's to protect you. Masks have wildly varying efficacies, anywhere from less than 10% to over 90%, the cloth types of masks. And so what you can do is really to focus on ensuring that you're using a mask that filters out things well and that fits well so that there's no leaks. And to test the filtration efficiency, it's hard for the average person to test this, but you're looking for tightly woven fabrics, a layer of specific filter material. This could be like what surgical masks are made out of. It's called melt-blown, non-woven polypropylene. Other types of filter materials also are out there, and really wearing that covering your nose and mouth anytime you're indoors with other people.
Dr. Marr, what have we learned about ventilation and disease transmission going back 100 years or more? I think back to the 19th century pandemic strategy, something called miasma therapy. They thought about bad air. And then there were TB sanitariums where they paid a lot of attention to ultraviolet protection, exposure to sunlight. People were wheeled outside, bundled up in the wintertime so that they could be exposed to the sunlight. And they really recognized that the air was important. Can we learn something from a century ago?
Yeah, miasma theory is kind of a mixed bag because it preceded germ theory. And so there was an idea that diseases were carried by bad air. Not necessarily certain bacteria or viruses, what we call pathogens, but really just the air coming from dead bodies, for example. And so germ theory came along and really debunked that. So there was kind of a pushback against miasma theory and the idea that things spread through the air. But in the early 1900s, I think people realized that fresh air was important. So maybe these germs were spreading through the air, and with TB. Certainly, they would take people outside for the fresh air and the sunlight. You get the benefits of much more dilution of any pathogens that are in the air when you're outdoors compared to indoors, and the benefit of sunlight, which kills these off pretty effectively. And around that time, too, buildings were designed, and they were designed to have good natural ventilation where you could easily open the windows. Nowadays, we have office buildings where you can't even open the windows, but the windows would open. They had radiators with heat that, we think about them overheating, making it too hot, but that forced you to crack open the window so you could get more fresh air through there. Florence Nightingale recommended and designed kind of Nightingale hospitals where they had large open windows and good cross ventilation to prevent the buildup of viruses and bacteria in the air.
You're listening to Dr. Lindsay Marr. She's a professor of civil and environmental engineering at Virginia Tech, where she leads the Applied Interdisciplinary Research in Air Laboratory. Her research group focuses on three main areas: how air inside buildings and outside in the natural environment affects, transports, and interacts with pollution; the dynamics of biological aerosols like viruses, bacteria, and fungi; and the characteristics of the tiniest of natural and man-made particles called nanomaterials.
After the break, find out how to assess whether a space is well enough ventilated or not.
Should we be thinking differently about ventilation?
I'm excited about our new device that measures carbon dioxide. How could that be useful?
This past winter has seen a lot of cases of COVID-19, but very few cases of influenza. How do we explain that?
Should we hang on to our masks and use them again during the next flu season?
We'll also discuss the best ways to travel safely on planes, trains, buses, and cars.
How can we address the invisible problem of poor air quality going forward?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
The People's Pharmacy podcast is sponsored in part by Kaya Biotics. Kaya Biotics offers the first probiotics which are both certified organic and hypoallergenic.
All probiotics are produced in Germany under laboratory conditions with high-quality ingredients and under strict regulatory oversight.
The three available formulas are created for very specific purposes, such as strengthening the immune system, fighting yeast infections, and helping with weight loss.
To learn more about Kaya Biotics probiotics and the important topic of gut health, you can visit their website, KayaBiotics.com. That's Kaya Biotics.com. Use the discount code PEOPLE for $10 off your first purchase.
Welcome back to The People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon.
The People's Pharmacy is brought to you in part by Kaya Biotics. Probiotic products made in Germany from certified organic ingredients. KAYABiotics.com.
Today, we're talking about ventilation and air quality. Should you invest in a carbon dioxide monitor? What will it tell you about indoor air? If you're planning a plane trip this spring or summer, what should you know?
Our guest is Dr. Lindsay Marr. She's a professor of civil and environmental engineering at Virginia Tech, where she leads the Applied Interdisciplinary Research in Air Laboratory.
Dr. Marr, the idea that we need good ventilation seems logical, seems obvious, and yet most of us have no idea how to assess the level of ventilation in our homes, in our kids' schools. How do we need to start thinking about ventilation differently?
The way buildings have been designed in recent decades is to save energy, which is certainly a worthy goal. And to save energy, what you do is you recirculate the air through the heating or cooling system so that you don't have to spend a lot of energy heating or cooling the outdoor air. You can just kind of keep the same air and keep cooling it down a little bit if you're air conditioning, or heating it up just a little bit more, keeping it warm. But I think the pandemic has made us realize how important having fresh air is. And this is, in most cases, the outdoor air is going to be cleaner than the indoor air, unless you're during wildfire season or you're in a heavily polluted city. So we want to bring in that outdoor air, but it's hard for the average person, of course, to know, what is the ventilation in a room like or building like, because you can't really see it. You can tell if the ventilation is really bad because you'll note that the air feels stuffy or there's smells build up in there. So that's one sign if the ventilation's really bad. If it's good, then maybe you notice open windows and you feel the breeze coming through. But there's a large kind of in-between area where it's really hard for the average person or even me to judge if I just walk into a place. One thing that I've been doing in the past few months is carrying around a carbon dioxide sensor with me. It costs about $100 to $200. And that can give me a kind of an immediate indication of whether the ventilation is good or not. Carbon dioxide is in our exhaled breath. And if the levels are really high in a place indoors, it means that it's building up. People's exhaled breath is building up. And if it gets above a certain level, that means with every breath I take, I'm breathing in some of other people's exhaled breath.
Well, speaking of carbon dioxide monitors, Dr. Marr, I acquired one about 10 days ago because a good friend of mine was basically advocating exactly what you've been doing. He said, if I go into one of those big box discount stores and take my carbon dioxide monitor with me, by the front of that store where the doors are always open, it's pretty good. But if I get back, way in the back near the restrooms, the carbon dioxide levels are so high, I get out of there fast. He said, this is a really good way to determine if the restaurant that I'm going into has good air circulation, ventilation or not. And I've been, of course, testing inside and outside. Outside, it's about 400 parts per million. Does that sound about right?
Yes, that's correct. That has been slowly increasing, of course, over time because of human activity and putting more greenhouse gases, including carbon dioxide, into the air. But right now, for the next several years, 400 ppm, parts per million outdoors is a good number. Yeah.
And what I'm seeing in our kitchen, where we have a gas stove, is about maybe 550, 600 parts per million. In my office, maybe about 550, 650. And I'm just wondering, what would be a bad number if you were to go into somebody's office where you work and their number was X? You might want to say, I'm getting out of here.
Right. I bring my own monitor into my office and the numbers get up to 600 or so, but it's because of my exhaled breath. And it's fine for me to breathe my own exhaled breath, right? I can't give myself the coronavirus. But a number that we use as a guideline, a target, is 800 parts per million, because at that number, it means that if you don't have other sources of carbon dioxide around, like a gas stove, or you're not burning anything else indoors, 800 parts per million means that 1% of your inhaled breath comes from other people's exhaled breath.
You know, before this pandemic, I don't think we ever even thought about breathing other people's air. It was like no big deal. But now we're concerned. And, you know, something interesting happened this past year, and that is that there was almost no influenza. I mean, people just didn't catch the flu. Why is it there were so many cases of COVID-19, but almost no cases of influenza?
That's a great question. And I think it shows that our precautions that we're taking against COVID really do work if the disease is not as easily as transmitted as COVID. So flu probably transmits mostly in the same way through the air. But flu is different because there's a lot of pre-existing immunity among the population. Flu is constantly circulating. It changes a little bit, but people have been exposed to it before, and their immune system kind of has seen it before, and it knows how to react. So flu doesn't transmit as easily. Now, what the big difference about the coronavirus is that we have a totally immunologically naive population. You know, we haven't seen this virus before, and it seems to transmit very easily. So, it has been remarkable that we've had almost no flu this season, and I've seen anecdotes from emergency room doctors too. They're not seeing other respiratory viruses. One called RSV, for example, where they often get cases, kids and other people coming in, and they're just not seeing it. So I think these precautions, the mask, the distancing, ventilation, avoiding crowds, they really do work, especially well for those respiratory viruses that aren't transmitted quite as easily as COVID is.
Dr. Marr, you are one of a handful of researchers who has really focused on the transmission of airborne pathogens. Will COVID actually change the way we think about disease transmission, do you believe?
I hope so. There has been a big shift in the past year, really more than I've seen in the over decade that I've been working on this. And some of that is due to the fact that the traditional definitions of different ways that respiratory viruses are transmitted have been shown now to be wrong. And this is something that I was aware of when I first got into this field, but those ideas were so entrenched. It was really hard to overcome them. But I think we are gradually doing that over the course of the past year. And I do hope that moving forward, we will start thinking really more accurately about how viruses and other pathogens are transmitted through the air versus through the large droplets and contaminated surfaces. There's a lot more work to be done, but there is really overwhelming evidence at this point that it is transmitted through the air, and we get it by breathing it in.
Dr. Marr, should we hang on to our masks and use them perhaps next winter against colds and flu like people in Japan and South Korea and Singapore and even China? In other words, there seems to be a cultural acceptance in many of those countries that has been harder for people in the United States and in Europe to embrace.
I think a lot of people have noticed that they've gotten far fewer colds and flus this year, at least partly because of wearing a mask. And I imagine that some people will continue to wear masks in the winter during the cold and flu season moving forward. Others will choose not to, and that's fine. But I think because of the pandemic and the widespread mask wearing in the US now, I hope it becomes more culturally acceptable. I was thinking about that just recently. When flying on the airplane, I may continue to wear a mask even after the pandemic's over, just because you're in those close quarters with lots of other people. Not only does it help protect you from pathogens that are in the air, but it also helps keep the air that you're breathing more humid, because especially on airplanes, the air is very dry. So there's more than one benefit, I think, to wearing the mask, and I do expect we'll see a little bit more mask wearing afterwards than we have before.
Dr. Mark, can you tell us a little bit about travel? Because a lot of people are just ready to go. Airplane travel is up and they think, I'm going to go ahead and take that vacation that I have delayed for the last year. What about things like airplanes, buses, trains, even cars for that matter, where carpooling as people go back to work will be obviously sharing air? Tell us about the best ways to get into any kind of a vehicle, whether it be in the air or on the ground.
CDC still recommends against non-essential travel, although I would say that for some people, a getaway is really needed for their mental health or, grandparents seeing grandkids. I would call that essential. So I think if you've been vaccinated, it's time to, and you want to travel, you can start thinking about that. And there's ways to make that, to reduce the risk when you do that. And that's all the same things we've been doing before, making sure you're wearing a mask. That's widespread now on airplanes and airports. It's a federal law. And trying to avoid crowds, pick times that are going to be less crowded. If you're in a ride share or a bus where you can open the window, do that. That'll greatly improve the ventilation. We're still concerned because there's still a lot of people who haven't been vaccinated. There are the variants. The vaccines might be a little less effective against them. The vaccines, though, are great. I mean, they do provide a lot of protection. It appears that they are going to greatly reduce the risk of transmission, too. But again, I would say all the same things, right? The masks, avoiding crowds if possible, ventilation. But I do hope we can get back to those regular travel activities probably within, I'd say, by the end of the summer.
Dr. Marr, we've all learned some things this year from the pandemic. We have all learned, hopefully, how to wash our hands properly. Some of us have learned more about cooking for ourselves. What overall lessons should we take forward from the pandemic for a healthier future?
I think I'm biased, of course, because this is the area I study, but that we should really pay attention to the air we're breathing and what's in there, not only for the risk of getting sick because of viruses, but also because of the really huge health effects that air pollution can have on us, too. Things like particulate matter in the air and ozone, are estimated to be responsible for 7 or 8 million premature deaths per year worldwide. And so, we pay a lot of attention to the water we drink and making sure it's clean. No one would take a drink from a glass of dirty water. I hope that we start thinking about our air in the same way and having a greater appreciation for clean air.
Dr. Marr, a lot of the problems with the idea of clean air is that we can't see viruses. We can't see airborne particles of pollutants. We're just sort of oblivious to the quality of our air. We are often exposed to things like fungi if we're in the South, which is where we are, and people have wet basements or crawl spaces. There may be, fungus among us. And the idea of trying to analyze the air and make sure the air quality is good enough to breathe, that's something none of us have really thought much about until the pandemic. How can we make sure going forward that, just as you mentioned, the water's clean, the air is as clean as well?
There are a lot of new developments coming out in kind of lower cost sensors for air quality, whether they measure particles in the air or carbon dioxide. But the combination of those two things can really tell us a lot about the whether our air is clean or not. And so I hope that we see greater penetration and greater adoption of those types of devices in people's homes. I mean, if you go on to if you go out there and search, you can find a lot of different products now under $200, and I imagine those prices will continue to come down, where you can get something that sits on your desk or on your on your bookshelf and constantly gives you a readout of what the air quality is like in your space.
We've been focusing a lot on viral transmission and bacterial transmission. We haven't talked very much about other conditions. So there are a lot of people who have asthma. There are a lot of people who have other lung conditions like COPD. How important is it for them to have high quality air?
If you have asthma or something like COPD or cystic fibrosis, or any type of other condition that affects your respiratory system, then it's really even more important to ensure that the air you're breathing is clean. Asthma can be triggered by mold, as we discussed, the fungus, or other chemicals in the air, or biological materials. And the cleaner the air, then the less likely it is that people will have an asthma attack or have difficulty breathing.
In wrapping up today, what would you like to tell our listeners about wearing masks, about making sure their environment has good ventilation, and in preparing for perhaps the next pandemic?
Well, there's really no question now that masks work. Again, they work to protect others and to protect you. The two things to focus on with the mask are the filtration efficiency, how well does the material itself filter out particles from the air, and then also the fit, because if you have leaks, then you're short-circuiting the mask and it's not doing anything. I do hope that we'll hold on to our masks that we've accumulated over the past year and can use them for in the future, maybe just in the winter time if you're trying to avoid cold, reduce your chances of getting colds and the flu. And I hope that there's been a cultural shift in the U.S. and greater acceptance towards wearing masks, because I think they do serve a great purpose. And, I can only imagine that we'll be better prepared for when the next pandemic rolls around.
Dr. Lindsay Marr, thank you very much for talking with us on the People's Pharmacy today.
Thanks so much for having me.
You've been listening to Dr. Lindsay Marr, Professor of Civil and Environmental Engineering at Virginia Tech, where she leads the Applied Interdisciplinary Research in Air Laboratory. Her research group focuses on three main areas: how air inside buildings and outside in the natural environment affects, transports, and interacts with pollution, the dynamics of biological aerosols like viruses, bacteria, and fungi, and the characteristics of the tiniest of natural and man-made particles called nanomaterials.
After the break, our guest is pediatrician Dr. David Peden.
Many of his young patients have asthma. What does he tell their parents about checking air quality at home?
Going back 100 years, what have we learned about ventilation and disease transmission?
We get Dr. Peden's take on Joe's carbon dioxide monitor. He also recommends a humidity monitor.
Beyond improved ventilation, what other steps should we take to protect kids at school?
You're listening to The People's Pharmacy with Joe and Terry Graydon. This podcast is brought to you by the Verrazana Health Club. This comprehensive home testing service enables you to track crucial health markers of gut health, inflammation, metabolism, hormones, thyroid function, and many other organ systems. Regular testing can help detect health imbalances before they lead to sickness. Online at Verrazana, verizana.com/health-club. Get 50% off the first month with the discount code PEOPLE50.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon.
The People's Pharmacy is brought to you in part by Kaya Biotics, probiotic products made in Germany from certified organic ingredients. KAYABiotics.com.
We're talking today about air quality and COVID. What do you need to know about keeping your home environment as safe as possible? What about ventilation in schools?
Our guest, Dr. David Peden is the Andrews Distinguished Professor of Pediatrics and Senior Associate Dean for Translational Research at the University of North Carolina at Chapel Hill School of Medicine. He's also Vice Chair for Translational Research in the Department of Pediatrics and Deputy Director of the Center for Environmental Medicine, Asthma, and Lung Biology in the Division of Pediatric Allergy and Immunology at UNC.
Welcome back to the People's Pharmacy, Dr. Dave Peden.
It's great to be back. This is an interesting topic.
Dr. Peden, we've just been talking with Dr. Lindsay Marr about air quality and how important it is for preventing COVID-19, as well as for people with breathing difficulties like asthma, cystic fibrosis, and COPD. Your thoughts?
Indoor air quality is absolutely essential for not just COVID, which has clearly brought things to national attention, but for a number of diseases. So, yes, I completely agree that air quality, both indoor and outdoor, is important.
Dr. Peden, Dr. Marr recommended monitoring the air in our homes. Here where we live in North Carolina, crawl spaces are pretty common components of homes, but they can be breeding grounds for mold or mildew. How can people check on the air quality in their homes or their workspaces?
Well, a common way or the most common way to do this, and most good home inspectors would be able to help you with this. A surrogate for how often the air space or the air shed in your house is being exchanged, in other words, you're getting fresh air, is to look at the level of carbon monoxide and carbon dioxide in the atmosphere, because stale air, particularly carbon dioxide, will collect. You exhale carbon dioxide, it gets trapped. So when you refresh a room, you actually want to keep that lower. So that's one way to do that, and there are devices one can buy that will actually help you with that. Another indirect way to look at air quality and look at air that is likely going to be healthier for you is to look at the humidity level. In very general terms, high humidity allows for growth of a variety of things, bacteria that contain endotoxins that can be inhaled and can be irritating. If one's allergic to fungi, fungi loves water. Actually, house dust mites love water vapor. So keeping your house below 50% relative humidity is also a really important thing. You mentioned crawl spaces, and the last thing I'm going to say in response to that question is having a good crawl space cover, an impermeable cover, whether it's plastic sheeting or whether you have a foam put down that controls the humidity of your crawl space, is really very important. A poorly maintained, poorly ventilated, or very musty crawl space will absolutely modify in a bad way the airspace in your home.
Dr. Peden, speaking of carbon dioxide monitors, we've got one sitting on Terry's desk. And I have to tell you, I've become quite fascinated with these CO2 detectors, because if you go outside, it's about 350 to 400 parts per million. It's pretty decent out there. If you go into our kitchen, it's about 500 parts per million. Sitting on Terry's desk right now, where it's been for about an hour, it's 1,100 parts per million, because the air quality in Terry's office right now is terrible.
Yes, it is terrible. We're talking too much, for one thing. And for another thing, we turned off the AC so that it wouldn't interfere with the recording.
And we're kind of surrounded by foam and a sound blanket. And so it's collecting our breathing. And that's like, oh, we had no idea that our little home recording studio has such terrible air quality. I bet a lot of people are clueless.
Well, and on top of that, although this is perhaps not as big an issue in North Carolina or southern climates, certainly in places where energy efficiency, and in fact, your energy company will oftentimes send you information about how you can tighten your home and how you can reduce your heating bill, and all of that. There's very good rationale for why you might want to be using less electricity and be having an energy efficient home. But to have a health efficient home, you want to temper that with adequate ventilation and adequate air quality management, which is either fans or ventilation. Ironically, air conditioning which was designed actually to reduce humidity. The fact that it makes the air cooler is a side effect of the intended use for air conditioning when it was invented, which was to help with in a cotton factory and a sheeting factory. So the air conditioning, even intermittent, even if it's kind of chilly out, or dehumidification can be really helpful. But in my estimation, air conditioning, which both dehumidifies the air, but also forces airflow. At the end of the day, it's having an adequate number of air exchanges in your house or in the room that you're in is what modifies the CO2. And the CO2 in and of itself is more a reflection of the air being stagnant. And so anything that's in that air that's aerosolizable, droplets that contain virus, bioactive molecules that or agents that are in building materials, all of those things like humidity, and they like relatively stale air. So the more you can, even if you program your air conditioning to come on every hour or so and ventilate for 10 minutes and then turn it off if your system can deal with that, or to set it at a high enough temperature so you're not uncomfortably cool, but you still get some airflow, all of that is a really great way to do it. The old-fashioned way is to open windows, which in many times of the year is okay when it's dry outside. If you're an allergic person, opening your windows today is probably not going to be a great thing because, at least in the middle of spring, that can be problematic.
Well, it turns out that CO2 monitors and humidity monitors are actually quite affordable. I think you can get a monitor for humidity for like under $50 and a CO2 monitor for under $100. So it's not out of the realm for most people.
Are there ways that people can evaluate the other spaces that they might be spending time in? For example, some children are now going back to school. How can parents tell whether the ventilation in the school is good? How can teachers tell? How can administrators tell?
Well, the first advice I would give is for the parents to ask their teachers or ask their school administrators this question. To be frank, I'm going to imagine that many school administrators have a lot on their minds in addition to air exchanges in their building. I think many have thought about it because ventilation and good air exchanges have been one of the ways that they try to make schools safer for COVID. So, and most school systems actually have buildings management staff that actually think a lot about this kind of stuff. So the first step, to be honest, is to make it, to ask the teachers or ask the school principal, what's the air exchange? Do we have healthy air or do we have stagnant air that's more likely to allow for transmission of disease or worsening of indoor allergies?
In addition to air ventilation, are there other simple ways to protect kids from COVID-19 when they do go back to school?
Well, some of this you've already heard before, but hand washing is 100,000 times and mask wearing are the two most important things that we can do absent actual immunization. And, the data are absolutely crystalline on this. There's no question that if you good hand hygiene and wearing masks correctly, which means the mask is not a chin strap. The mask goes over your nose and over your mouth. In fact, the nose is hugely important. Your nose is basically the catcher's mitt for coronavirus, period. There's more receptors for the virus in your nose. It avidly binds the nasal epithelium. So ceremonial masking that doesn't cover the nose is kind of pointless. So those are two really important things. Common sense and whatever spacing. Right now, the CDC is recommending that in most school settings, 3 feet versus 6 feet is probably adequate. And I think that the CDC has researched this fairly adequately. So how far apart the school desks are spaced, whether or not kids are going to school in shifts so that you don't have a huge a large number of people in the same enclosed space. which is which is the recipe for transmission. Lots of people in a small space breathing without masks is a lot more dangerous than a moderate number of people that are well spaced out with good masks, good hygiene, and on top of that, good air exchanges. It's interesting. Many people are worried about air flight, but airplanes are actually really good at air exchanges, as an aside.
That's good to hear. Dr. Peden, you take care of kids with asthma. How risky is COVID-19 for people with asthma? We've seen a couple of studies that actually suggest some of the measures that have been taken have improved the outcome for children with asthma because they're not being exposed to colds and flu.
So that's absolutely correct. It turns out that the number of hospitalizations for asthma, for acute asthma, have gone down. I'm involved in a couple of asthma studies, and actually one of them is based on frequency of exacerbations. And to be honest, because many of those patients are appropriately isolating or social distancing, we're not seeing as much overt exacerbation. Whether it's a lesson we'll take is another issue. But the fact is, social distancing and masks, while we've done it for COVID, is also really good for rhinovirus, is good for other related viruses, adenoviruses, and other coronaviruses that are not the SARS virus that causes colds. And there's no question that viral respiratory tract disease is the single leading cause of acute worsening of asthma. So that one particular problem is true. The other thing that's true is that people with allergy and people being treated appropriately for allergy with nasal and inhaled corticosteroids, it turns out that the ACE2 receptor, which is part of the way that coronavirus makes its way into the body, it's actually less well expressed in allergic individuals than it is in non-allergic individuals for whatever reason. So for once, there may be a protective effect from being an asthmatic with specific regard to COVID. Make no mistake, an asthmatic can get COVID and can get all the horrible consequences that some people have experienced with that disease. But as a population, asthmatics tend not to have had as much problem as other groups. Diabetics, people who are with elevated BMIs, smokers seem to be at a higher risk, but asthma is not proven to be a risk factor.
Dr. Peden, will you be recommending that your patients wear masks during flu season going forward?
I will. What I will probably do is point out medicine's an interesting thing. It's a partnership between physicians and patients. And what I learned a long time ago is I got chastised by saying, well, here's what we're going to do. And this patient's mother said, we're not doing anything. You're not in my house at 2:00 in the morning. And she was right. But what I would recommend to people is that what we found was that with wearing masks and good hand hygiene, all the elements of asthma were reduced. And so if you have a kid that is particularly brittle, it would probably be a good idea to wear masks more commonly and to wash hands. The driving factor is going to be the social element and whether or not peer pressure and social acceptance of that will be such that people will be comfortable enough doing that. But for somebody who has horrible asthma during flu and cold season, I would definitely do that. You mentioned flu, and there's zero question that asthmatics everyone should get a flu shot, but this is especially true for asthmatics. And for adults with asthma, it's also important to get a pneumococcal vaccine.
Dr. Peden, what have we learned from COVID, and how will it impact the practice of medicine and how patients behave going forward? I'm thinking for the first time, tens of millions of people are thinking about air quality, about ventilation, about not just airborne viruses, but other pathogens and pollutants, particles in our air.
Well, so first of all, I think simply being aware that your environment does impact your health very directly has become very clear to many people. So I think that taking steps to be preventive in that fashion will be helpful. What will be interesting to see is if down the road societies will actually help fund that, and if that investment will actually be reflected in much lower healthcare costs going forward. So that's item one. Item two, I think, is I think that with the advent of telemedicine, which occurred as a result of COVID, I think that the importance of computer literacy and access to computer and internet capabilities has become more clear than ever. So for health disparities, we need to ensure that all people have access to this. Why? Because it allows for more convenient access to medical advice. A lot of the advice you need is coaching over whichever platform. And occasionally you actually, as a physician, I've identified people say, we need to do this in person, or you need to go to the ER. But it is potentially lowers a barrier for people for actually getting health advice. And the last thing is, I think we've learned that, up until the rapid development of vaccine, the proven and effective way to deal with this was using technology that is centuries old. When you look back at the flu pandemic in 1917-18, what was helpful? Masks, social distancing, less clustering of people together. And where it was horrible, because it happened during the First World War, it was when you had soldiers all clustered together in small areas at military camps. So those kind of commonsensical things, I think, are the most important in terms of how people protect their health.
Dr. Dave Peden, thank you so much for talking with us on the People's Pharmacy today.
Well, thank you for having me. I enjoyed it very much.
You've been listening to Dr. David Peden, the Andrews Distinguished Professor of Pediatrics at the University of North Carolina at Chapel Hill School of Medicine. He also serves as Senior Associate Dean for Translational Research, Vice Chair for Translational Research in the Department of Pediatrics, and Deputy Director of the Center for Environmental Medicine, Asthma and Lung Biology in the Division of Pediatric Allergy and Immunology at UNC.
We spoke earlier with Dr. Lindsay Marr. She is Professor of Civil and Environmental Engineering at Virginia Tech, where she leads the Applied Interdisciplinary Research in Air Laboratory. Her research group focuses on three main areas: how air inside buildings and outside in the natural environment affects transports and interacts with pollution, the dynamics of biological aerosols with viruses, bacteria, and fungi, and the characteristics of the tiniest of natural and man-made particles called nanomaterials.
Lynn Siegel produced today's show. Al Wadarski engineered. Dave Graydon edits our interviews. B.J. Liederman composed our theme music.
The People's Pharmacy is a co-production of North Carolina Public Radio, WUNC.
If you would like to buy a CD of today's show or any other People's Pharmacy episode, you can call 800-732-2334. Today's show is number 1253. That number again, 800-732-2334. You can also place the order online at peoplespharmacy.com.
When you visit the website, you can share your thoughts about today's show. How do you assess the quality of the air in your home or apartment? You can share your experience at peoplespharmacy.com in the comment section of today's show notes.
You can subscribe to our podcast through your favorite podcast provider. We post the show on our website on Monday morning. You might want to share it with a friend or family member.
At our website, you can sign up for our free online newsletter to get the latest news about COVID-19 and other important health stories. By subscribing to our newsletter, you will also have regular access to our weekly podcast. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.